was the transition from University of Calgary, sort of, if you can remember back a couple of years, like how overwhelming was the material coming at you? How did you manage your weeks? What did kind of your beginning, whether you go by week or month or whatever, what did it look like for you?
Yeah, no, I think understandably, and I don't think anyone will ever tell you medical school is sort of easy. It's a lot to adjust to. For me, um, like the Australian part wasn't as bad for me, like adjusting to Australia, because it is pretty similar, but also I've had a lot of experience moving around the world. If you draw a line to all the places I lived, it's literally a line across the globe. And so that part was actually very quite simple for me, relatively speaking, but obviously it's really hard sort of making new friends and adjusting. But UQ does a good bit, starting you off a little slow. They throw a few scary lectures at the beginning to sort of kick you into gear, but giving you time to sort of adjust to the system and adjust to sort of the new people who are the new curriculum, sort of the requirements of a medical degree. The way I put it in that it's pretty similar to if you're like in a competitive undergrad program or like, which I'm sure most people are, or trying to sort of, push yourself and do well. It's a lot of material. I think the hard part is remembering like how much you need to know and what you need to know, and like how do you study for medicine? Because I think an important thing to keep in mind to everyone applying, it's yes, it's just a 4-year degree, but your last exam is about 12 to 15 years after, because you do exams in residency training, you do exams in internship, you do exams in your fellowship. So the actual study part never really ends. And that's nothing exclusive to UQ at all. And so I found the first bit, like first semester, my first exam did not go very well. But there's some great academic advisors who sort of go through it, and you learn just by trying different ways, like what helps you learn or what helps you remember. And for me, it's a lot of like visual and practicing. So the first year is a little bit of a grind to try and sort of, figure out how to study and get a lot of that. And then once we really started in a hospital placement, that's when it really clicked for me. Because I was like, usually, and everyone in here will see this, once you see a patient with something, you never forget it. And so you kind of hope you get lucky, and then every patient you see ends up being a tough question, which, you never know. But yeah, it's a lot to adjust to. But the way I think of it is like, whatever you're currently doing for your undergraduate, take that. Let's say you do like you're studying, you do your exams and everything, you do like 3, 4 hobbies a week. You pretty much kind of got to cut those 3, 4 hobbies down a week to one or two. And that's medical school, really. It's still a lot. It's still like you can still maintain a good work-life balance and do everything you want to do. You just won't have as much time. It's about whatever you're doing now, 20% of time to other stuff you probably chuck into more into school, and the rest sort of continues as normal. But everyone has their own way of adjusting.